Health systems all over the world are currently responding to the COVID-19 outbreak. In the absence of licensed vaccines or therapeutics, infection prevention and control (IPC) is the mainstay preventive measure for healthcare workers and communities. The Ministry of Health of Uganda, in collaboration with the Infectious Disease Institute (IDI), have prepared this training material to provide an understanding of the principles of IPC during the processes of screening, triaging, and management of patients being investigated for COVID or with confirmed COVID-19 disease.
In this video, I'm going to take you through hand hygiene and the technique of hand washing and hand rubbing. Hand hygiene is the most important measure that you can do to protect yourself, your patients, and the community. Perform hand hygiene before and after contact with the patient, after contact with the patient's body fluids, before and after procedures, and after contact with the patient's environment. We should perform hand hygiene for at least 30 seconds by washing hands with soap and water or diluted chlorine solution, following this technique. Wet your hands with water. Apply enough soap to cover all your hands. Rub your hands palm to palm. Rub the back of your hands with fingers interlaced, left over the right and vice versa. Wash the palms of your fingers interlaced. Interlock your hands and wash the back of your fingers. Rub the left thumb clasped into the right palm and vice versa. With clasped fingers on the right hand, rub the fingers in a rotational movement and vice versa. Rub your wrists. Rinse your hands with water. Dry your hands with a single-use disposable towel or let the hands air dry. Use a towel to turn off the faucet of the tap or rinse the faucet and then turn it off. You are now safe to continue with your activities. I am now going to take you through the technique of hand rubbing. Rub your hands with alcohol-based hand rub containing a minimum of 70% alcohol, following this technique. Apply a palmful of alcohol-based hand rub in a cupped hand, covering all the surfaces. Rub hands palm to palm. Place your right hand over the left hand, interlace the fingers and rub the back of your fingers. Rub your palm to palm with fingers interlaced. Interlock your fingers and rub the back of your fingers. Perform a rotational rubbing of the left thumb clasped in the right palm and vice versa. Perform a rotational rubbing backwards and forwards with clasped fingers of the right hand in the left palm and vice versa. Once you finish, let your hands air dry and you will be safe to continue with your activities. Soap and water or chlorine is used when hands are visibly soiled, while alcohol-based hand rub can be used in all the other circumstances. Ensure that you have all the necessary supplies for hand hygiene before starting the procedure.